Prior to the beginning of today's session, I request you all to drop your queries that will get in between the session to our live chat box. So we'll be discussing it at the end of the webinar on our discussion session. For now, I would like to move ahead to inaugurate today's session, and we are going to have our session today on role of optometrists in rehabilitation services in low vision management. And to cover it, we have our speaker, Ms. Yogita Rajgandhi. She is a consultant optometrist and faculty president of VOSH India USA India chapter, joint secretary of Indian Optometric Association, editor at Delhi Optometric Association, and an ex-head of Low Vision Center and a V workshop for the blind. So Yogita ma'am, I welcome you to our Mero Eye IDEX platform on the behalf of all our participants and Mero Eye. Thank you so much for joining us. Over to you, ma'am.
Yeah, thank you, Solo, for the giving me the introduction, and good evening, everybody. Namaste. I'm sure all the participants are in a very safe and healthy mode today. So, thank you, Mero Eye, for inviting me as a speaker for the topic of low vision. I'll be presenting today on the role of optometrist in rehabilitation services in low vision management. uh, my inspiration. I always start my presentation by inspiration. So these are the visually impaired females from Mumbai, and I think so. When I look at them, each day make me remember, like, yes, I can do it. So they are the inspiration, and I'm sure each one in each visually impaired can make a very inspiring person to everybody's life. World Health Organization, I'm sure everybody knows about this Vision 2020, right to sight and avoidable blindness by the year 2020. Of course, we have eradicated, or we have reached to certain target what we have decided maybe 2 decades ago, but still the data shows that there are percentage of the reduce in the visual impairment is not subsequently reduced as what we expected. So, what are the basic human needs? Self-actualization, esteem, very important, confidence and achievement, and social needs. We always need a friends and family, especially in this pandemic time. Safety and security of the each person in different sphere. Of course, you need a physiological needs to survive, and Wi-Fi. I'm sure everybody agrees on that because of Wi-Fi. Because of, I mean, without Wi-Fi, we all cannot live about. So, what is a global blindness and what we can do for this? What are the resources available for it? So, there are more than 100 countries that have established a different program, and those group programs like government organizations and non-government organizations, all organizations probably contribute more than $100 million every year, but still it's not been enough and adequate for it. So good coordination in Vision 2020 program, the Minister of the Health in each country, ophthalmologists and other eye care professionals, and of course NGO, that's a non-government organization who are working for the eye care and to reduce the blind in different country, in different continent, maybe come together and they can work together. WHO says, what is rehabilitation? Initially, we, being an optometrist, we do the optometry workup, we do the low vision workup, then we have the different kind of a rehabilitation. But what I have seen in my practice, most of the optometrists generally restricted to the prescription and the evaluation of the low vision optical and non-optical devices. But I personally feel it is the incomplete management. Without rehabilitation, I don't think so low vision can be completed. And it's a very important aspect of the low vision management. So the WHO says the rehabilitations and habilitations are instrumental in enabling the people with a limitation in functioning and remain or in return to their home and community, which can live independently, which they can practice or participate in educations and the labor market or the civic life. What we all are living is a civic life, and definitely they also have an equal right and opportunity what they require and what they desire. So access to rehabilitation and habilitation can decrease the consequences of disease or injury which can improve our quality of life or decrease the use of health services. Of course, rehabilitation, there are many professionals which I'll take it further in my slides, okay, who all can work together and who can reduce this kind of burden to them, and it can improve the quality of life, which can definitely make wonders to their life. So this impact of disability for an individual, which enabling him or her to achieve independence, social integration, very important factor. We all like to communicate, we all like to attend the social and gathering and functions. And there are so many other social functions which probably they must be deprived of. So better quality of life, and of course a self-actualization, which is a very basic need. Each one of us know, okay, what we are and how, what is my identity, and how that identity can make a big role in the community, society, or the family itself. So I think, so me, I, you, everybody needs identity. So rehabilitation, thus a coordinated use of all the services and train the client to the highest potential. There are certain factors which I feel which are very key factors to the implement any kind of a low vision services, whether it is the evaluation or whether it is the referral cases, whether it can be even the rehabilitation services. So whether it can be easily accessible, and whether it can have the awareness amongst the patient, among the family, amongst the professionals. Many times we come across there are people who do not know certain kind of a, the patients do not know about it. There are I'm sorry. Yeah, I'm sorry. uh, So many times it come across many professionals in particular state or in the country, they do not know that certain professionals are available, they are having the center, they are the treatment or the rehabilitation services, or the certain professionals are available for certain particular special children's. So awareness amongst the professional, amongst the children's, amongst the teacher and the parents is very important. Then it can be accessible or not, whether it is within your limit to reach over there or not. You don't need to travel a lot. Quality of uh, executing of the particular service is very important. You just don't want to do it the sake of doing it, because it takes a lot of time, it requires a lot of patience, you need a real good counseling sessions. So that is also very important. Affordable, of course. What the research says, key low vision patients are mainly come from the poor background. So poverty and the visual impairment or the blindness have very good connection between each other. And that's the reason many times the visually impaired people cannot able to afford such kind of a services, even though it is available or accessible. Time management, yes, on the both the sides the time has to be maintained. You have to spare a time, you may have to visit 3 or 5 or 6 sittings, depends upon the each individual, each case of the low vision. Even though there are 10 diabetic retinopathy patients or pre-retinopathy of prematurity patients, but all 10 may not require the same kind of low vision management, because each child, each patient, each individual is unique, and their desire, their lifestyle, their requirement, their hobbies, everything is different from each other. So there is no set thumb rule kind of a thing. So definitely for that also the time is very important. The one thing which I felt is trust. The trust is very important between the professional people and the patient or any visually impaired people. Until unless you do not trust your doctor or your teacher or your person whom you going to receive the treatment, I think so the 50% of that treatment may not be very effective. And that's what we say, mental health. So how far your mental stability is there. And that is why the trust is very important. Coordination, communication, social skills are very important for management. And yes, health ego, what I feel about is like a professional, within the professional there should not be any kind of a professional ego about it, or any kind of a discomfort. You can definitely refer to tertiary or secondary level the eye hospital, where this kind of a low vision management is happening around. So rehabilitations does all the measures like reducing the impact and the disability of that, enabling to achieve independence, as I said, social integrations. Definitely in 95% of the patient of mine, I have felt the quality of life has improved. Self-actualizations and the disabled person, their physical, their mental, their emotional, social, vocational usefulness, all which can be capable of that thing. And it can be a long term or short term program. So we cannot, as I said, you cannot have a thumb rule for this. The slow vision services can be given at primary level, secondary and tertiary level. Now for the primary level, community-based worker identify and they refer to the higher level. For the secondary level, they advises on the environmental modification at the district level. And the tertiary level, the team of trained professional like ophthalmologist, optometrist, orthoptist, vision rehabilitation specialist, all offer different advanced care group and specific in the low vision clinic itself. Whether you have an eye care clinic, whether you have the optometry clinic, after doing this low vision special clinic is definitely required for certain kind of a rehabilitation services. So early intervention in the child is very important. It can be done with the parents counseling, referral for the multidisciplinary approach. There are three different approaches, which I will take it eventually under my next slide. Assessment is done in all areas of development. Instruction and the training of the parent and child is very important. It's not just about the prescribing the optical devices, but how to use it. What are the modifications? What are the doctor of ergonomics, what we say in computer vision syndrome? The same kind of a thing also works in a low vision management. And very important tool is follow-up. Until unless if you do not have follow-up, that patient is left half around. And then that can be risky for the patient itself, for the society and community, because that gives the wrong message to the surrounding people around, and that cannot give you the satisfaction, and that creates a more kind of the stigma, like whether really it's going to work or not. So follow up is very important for any kind of a low vision services. The early intervention program, it can be based on child alone, child and family together, center based, it can be home based, it can be hospital based, or combination of any of them. Now this patient, what I had is the entire family has been suffering from retinitis pigmentosa. And in spite of visiting more than 45 to 50 clinics, they could not able to come to the conclusion what is the ideal solution for them and what should be next done. And after that, once they visited the low vision clinic at NAB India, and finally I could do the total rehabilitation. And today I can say that, okay, the girl has studied till 7th, 10th, 11th, 12th standard. And after that, she could pursue her computers also. She could apply for many exams. She completed her computer exams. She secured with a very good. She started working. She got married. Now she is a mother. And she's been earning now. And the family is dependent on her. So you can imagine the child who was not living out of the house. Now she's able to do the mobility and independently moving. So this is the basic advantage of rehabilitation service. But optometry plays very important role. So there are approaches in providing the low vision rehabilitation: multidisciplinary, interdisciplinary, and the transdisciplinary. We will see all three of them one by one. In multidisciplinary approach, where the various areas of expertise in different disciplines evaluate, work with the patients individually. They work done in isolation in a very professional manner, but the information is shared at the case review detail. Each professional will give their inputs individually to the patient. This approach is designed use in a medical setting. The drawback of such approach is, however, that it is frequently difficult to bring all the involved professionals together. And the information among the professional men have some conflict, adding to that controversy, and which can about service are needed, which who will decide and who will provide to them. So there are certain advantage, but there are disadvantage. In interdisciplinary, where the team members assess the child individually, but they convene and to discuss the finding, and they form a joint recommendation to what is the best thing or best rehabilitation service for the one child. But in transdisciplinary, where all the team represent in a one place, and the child or the parents and the child is observed, discussed, evaluated, all one at the one time and the one place by the different individuals or different professionals. So thus I think so it's providing an evaluation of the total child in a one way and a one time also. So that is the best transdisciplinary approach. Very few centers may have this kind of a facility, but doesn't matter. I think so even the patients, as I said, the time management, health ego, awareness and everything is, if the patient is able to do it, then I don't think so there should be a problem whether it can be trans or interdisciplinary approach. So most important adoption approach by employment exchange, which is there in most of the district, state and the country. The vocational rehabilitation centers are available. District rehabilitation centers are also available, and voluntary placement organization like non-government organization. They can also help you out for certain kind of services. This is one of the best community-based rehabilitation, but unfortunately, sometimes in a rural area or the urban rural area, lack of professionals or lack of awareness, we could not able to reach out to the deserving candidate. So what it focuses on enhancing the quality of life, people with a disability and their families, meeting with the basic needs, and they're definitely ensuring the inclusion criteria and the participation. So it is a multi-sectoral strategy that empowers the person with a disability to access a benefit from the education, employment, health, and social services. This community-based rehabilitation is through the combined efforts of people with disability, their families, their communities, the relevant government sectors and their non-government health department, education department, educators, counselor, vocational services, social and other services. So all people come together in particular community, whether it is in a district, whether it is in a rural area, and that you can make a difference to the community based rehabilitation. Uh, in next one of my picture, I'll explain you how one person has done the community-based rehabilitation. An entire village in the state where I live in Maharashtra is being empowered, and most of the visually impaired today are been getting education at the right time and they've been empowered. So it has a very good effect and very good advantages across if you do it at the right time from the right person, you know. Education rehabilitation, where meeting the education need of the visually impaired, the child is perhaps the most challenging responsibility of the parents. Whether you should decide what kind of education system will be better for my child. So there are three different models like special school is available for the blind, integrated education and inclusive education. All three different education systems are different. Every child, again, as I said, is a different. You cannot say retinopathy of prematurity or the albinism or the the cataract patient, any kind of a retina dystrophy, AMD can have the same kind of a education system. So as I said, everybody, the professionals, parents, teacher, counselor, optometrists need to evaluate the child, and then we need to sit together and think about it. Okay, what is the best for this child? The vocational rehabilitation, of late, we are more emphasizing on the word called vocational. It means the part of continuous and the coordinated process of rehabilitation, which involves the provision of those vocational services like vocational guidance. It is mainly about the vocational training and selective placement designed to enable a disabled person to secure the suitable employment. Where I would like to say here, this is the definition as per the International Labour Organization, ILO, but uh, the person who is not able to pursue the education, the basic or formal education, who can able to get some, have the skill, and I'm sure every person has a skill, only thing we need to implement or train them in the proper way, and after that that person can able to execute the particular training, and it can lead to the suitable employment, which he can become a independent, he start earning, so he's not dependent on the family or the community. So that's a basic principle of vocational rehabilitation. It covers mainly a skillful work in a short or small section of the work, which usually visually impaired can perform unless the educated, and proper evaluation training required in the each section. Job training, job modification, restructuring, and the job placements are the key factor in the vocational rehabilitation. I have few pictures which I'm going to see further and show it to you. Social rehabilitation, where it plays very important role in developing communication skill. Hence, the visual impair increases the risk of developing communication disorders because they are not able to shake hands, they are not able to identify the faces, they don't know to whom they are talking. It's very difficult to see the gestures. So that is why there are certain social skill, the lack of rehabilitation there, especially in case of eye disease such as neurological visual impairment and retinopathy or prematurity. But of course, with a passage of time and with the counseling and proper rehabilitation services, you can definitely make a difference to this patient as well. The communication disorder is a persistent difficulty in understanding and use of spoken or the written language. That is one of the biggest challenge we generally face it. So how does the visual rehabilitation works? The visual rehabilitation, as I said, once you do the optometry workup, then you do the low vision workup, there comes the visual rehabilitation. Whether you prescribe the low vision device, optical or non-optical, for both you require a visual rehabilitation. So it can be for the both visual impaired and the blind as well. You need to give the mobility training, you need to give the adaptive skill training, like how to use the telescope, whether it is a spectacle mounted, whether it is a handheld telescope, whether it is a binocular, at what distance you are looking and what is the size of the object, and which eye is better, which is a dominant eye. So this all comes into the visual rehabilitation, and how you need to have the hand and eye coordination. So that also works in this. And low vision instruction need to give it initially how far you have to use, how many days you need to take a training, and after that gradually you can increase your visual devices. It's just not like a normal spectacles, but of course it is just like a progressive bifocal or high index glasses, or maybe you have multifocal contact lenses, and then you need to give some instruction in that as well. So same kind of a instruction here also it is required, whether it is a non-optical, even writing guide or reading guide or typoscope or signature guide, so those kind of instruction for each optical and non-optical devices, electronic devices, you must give the instruction to the patient, and that comes into the visual rehabilitation. The low vision career services, what can be after the pursuing the education, what are the option available for the student or the applicant or the visually impaired person, whether he can go for the post graduation, whether he can work and do some the corporate level services, or he can join the bank or government agencies, and what are the options available for the employment. So right kind of a service, career counseling is also very important to them. And you need to be connected with the government on the state level or district level, what are the options available, then only you can able to guide the visually impaired. And being an optometrist, it is very challenging. We have to come out of the box and think about it. This is also the part of low vision, and that's why I said it is a very comprehensive management required. Low vision training and psychological counseling, this is the uttermost important, like whether they are having any kind of a fear, anger, any distress, demotivation, discouragement from the family or the community, and people say you cannot do it, you are a failure, you are that, you will not able to achieve this. So this kind of lead to more kind of a depression to them. So psychological, psychosocial factors plays very important role for certain low vision patient, and this visual rehabilitation plays very important. Here the student which I had a long back in my clinic in NAB India, and I was giving the training of the writing guide for the student, which worked very good with the felt tip pen or the 3B pencil, black ink, and how to hold the spectacle magnifier. You can see the distance is very close. You can have the reading lamp also behind the head of the patient, and it should fall on the reading material what the patient is reading, not on the head of the patient. In the left and bottom side there is a signature guide, so you train the patient how to sign it, and wearing the reading glasses, and you have the handheld telescope in the one of the eye. So vision rehabilitation services allow people who are total blind or have a low vision, which live independently and maintain quality of life with the self-respect and dignity. I'm sure everyone agrees with that. We all need to have the self-respect. We have a dignity, and we need to respect each other also. And that is why it is uttermost for the visually impaired people also. So these services are available by eye care provided by ophthalmologists, optometrists, a team of specially trained professionals, including low vision therapist, a vision rehabilitation therapist, and there is a specific course going on in certain tertiary level center in India, and orientation and mobility specialist. This is very important. Of course, the NAB India is doing most of the courses except the low vision therapist and that, but most of the vocational social orientation, home related, and every vocational, most of the courses are available with an app. And I think so visually impaired in Mumbai and Maharashtra are very lucky and fortunate to have access all this kind of services, this is one which I have done for one patient to train them in the clinic. uh, I would like to say here the blind child and education method. As we said, for the blind, there is a braille option. This is the one of the mode of education. Then there is a large print and audio cassettes. And nowadays you have so many digital device technologies helping out. So probably I think so they are more fortunate to use those technical and the digital devices for their education method also. Accessory devices are like talking books, as I said, one of the way of learning. Reading stand, recordings are there for all the education syllabus. Talking clocks, which remind you about the time and the alarm. Calculators are there. Talking calculators are also there. The radio, swing aids, and signature guide. For that, each devices has a different significance and different advantages. Some of the things which I can show you, and most of them probably must have seen it. There is a reading stand on the left upper corner. There is a talking watch, and then there is a reading lamp, which is a solar one. And there's a needle and thread, and the white cane is there with a different size. It depends upon the height of the patient, and according to that, we can decide okay, what kind of a white cane we can give it for the orientation and mobility. There are certain electronic magnification also, like CCTV full system, which can be portable, which can cameras, or we can plug it into the regular TVs or computer also. There are large spread computers and different hardware and software available. And low vision enhancement system, black and white or white and black. Headbone CCTV display are also available. Amazing human facts. You blink over more than 10 million times a year. So these are the human resource, ophthalmologist, as I said, optometrist, refractionist, orthoptist. You have the rehabilitation special multi-skill workers, teachers, primary eye care field workers, ophthalmic clinical officers, nurses, ophthalmic technician, and community-based workers. That's the reason I put up this picture, because it is the teamwork and each one has to support each other. So role of rehabilitation person, counseling, as I said, individual, family, and community, understanding the problem, developing the modules for them. You teach them and train them, including mobility, and networking with other agency. It may be government, it can be school, it can be non-government also. Like Alliance or Giants International or Rotary Club also come forward and extend their support for the low vision devices. You need to encourage the patient to use appropriate strategy, whether it is emotional, social, educational, or vocational, or it can be multidisciplinary, whatever the best thing required for the patient. These are the different organizations for the welfare of the blind. National Institute for the Visually Impaired in Uttaranchal, Arvind Eye Hospital, Blind People Association in Gujarat, a National Association for the Blind in Mumbai, Sri Ramakrishna Mission in Tamil Nadu, the National Federation of the Blind in Delhi, Rehabilitation Council of India, and All India Federation of the Blind in Delhi. So these are the high apex authority who works for the visually impaired and blind in India. There are different schemes and concession available with a person with a visually impaired. This is one of the part which you have to take care in the rehabilitation services. So air travel is possible. They get a different discount and scheme, postage, telecommunications, customs and concessions, convenience allowance is there, income tax concession is there. If you start with a small business, you have dealership and agency from the oil company, reservation of the job is there, purchase or fitting of different aids are there, the family pension, unemployment allowances, assistance for the self-employment, pension for the old age, bank loans, subsidies, integrated education, and educational concession in CBSE board. So these are the different schemes are available. And when you practice individually, I think so one person or as an optometrist or as a low vision therapist, you must know most of the things which is available within your country. It may varies from country to country. So what are the challenges you face while executing the rehabilitation services? It can be language can be a barrier, human resource, as I said, accessible or awareness, traveling time, the mode of transport, the local support from the government sector, it can be state or district level. Financial constraint is always going to be a problem with the visually impaired. The social and the health workers, the location or the infrastructure, how to start. Many of you might think you want to start this kind of a services. You might think you may require a bigger infrastructure, but believe me, you do not require such a big infrastructure. Within a 2 rooms, one is for the low vision and other for counseling on the different schedules. Maybe you can think and you can plan about it. So there's not much investment required. Of course, I can take a different presentation on low vision practice management. The referrals, follow-up, media support. You need to make awareness. Referral is a very important. You need to get connect with the tertiary and secondary level and ophthalmologists who get more of referring patients for you. The providing visual devices. Sometimes you do not have good dealers or distributor to supply the low vision devices on time. Self-motivation, passion, hard work. Of course, this required from the optometry side, and understanding the need of eye care professional, because each patient who comes to you, who walk into your clinic is very important. They come with a lots of hope and you are the one who can do justice to them. That's what I believe it. You need to push it up, pray until something happens, and you need to push until you don't push it. I don't think so something can be achieved. So what is the situation demands here? The generate awareness about amongst the ophthalmologists for increasing referral rate to the LV centers. Of course, you can have the referral letters and thanking letters and make them update about it. Okay, what is the next you are going to do it, or final when you complete it. I think so you need to acknowledge them, and that's the way you can build up a good relationship. Increase the center by training awareness program within the professionals. You must do time with the passage of time, every 3 to 6 months you must do training program. What is new available in technology, that should be make available to the professional also. And strengthen the existing center by continuing education, infrastructure and development. And that's the reason you should never stop learning. I think so once you stop learning, your the goal doesn't achieve. The conducting more awareness workshop, funds are provided for cataract surgery, free spectacles, but unfortunately for low vision devices, there are very less fund available. So research grant to manufacturers to the institution for developing newer and cheaper devices. This is what the future or the current demand is there. And I think so one should look into that, and somebody should come forward, and like-minded people should think about it, irrespective whether you are in a which country or where you are practicing about it. So what is next? Like this rabbit, even I was looking for that. And then I thought, okay, in my country, in India, what is there which I've showed you, but I wanted to go to the global level and what happens next. So in the global perspective, there are so many services are available, like telephone reassurance, homemaker, transportation, information and referrals, Meals on Wheels, friendly visiting, legal assistant, case management. Senior centers are available, adult daycare center, and personal care. There is a getting around safely indoor and outdoor. You can manage with the different mobilities, skills, using the telephones, eating skills, shopping, cleaning, household organization, reading and writing, home and kitchen safety. These are the different kind of services are available in the Western world. So different communication skills, as I said, reading, writing, braille, assistive, computer technology, this all can access to communicate well at home, school, or work. The counseling skills, whether it is a spouse or family members, friend, which can adjust to your vision loss, accept the status of visual acuity, it depends upon that. So aware about the reality to cope up with the current available option, which can further deals with the psychosocial factors well with the visually impaired. So counseling plays very important role. Independent living and personal management. It includes the home modification. You need to make it dark with a light color, your walking, the floor, and there are so many other modification in the furniture and the colors of the rooms that you can do it. The personal self-care, leisure activity like a sports or swimming or the indoor games, home repair or mechanism, operating telephones, and financial management. It's a very important financial man. You earn money, but you don't know how to manage yourself in the final. You need to learn how to go to bank or do the net banking and all that stuff. So, it's very important for them to visually impaired, because the trust comes a very important factor when you have the financial management. So independent movement and travel skills also, because it gives the clear instruction about orientation in whether it's in indoor, whether it is an outdoor environment, and traveling safely outdoor with a long white cane or any other devices, like you have a GPS or you have a Google, which can able to guide you. And those systems are available now, luckily. So in the personal self-care, you have labeling the course, laundry and laundromats, and then you have makeup applications for the female, and there are tips and techniques for the fingernail care, and then you have a toothpaste applications and the tips to help with the shaving for a man as well. So different pictures I have. On the left upper corner, there is a toothpaste applications, then one man is shaving, and the last on the right and bottom corner, how to take care of your nail. So different procedure can apply with the devices. And many people think, how can you shave when you cannot see? But different kind of a high ended high magnifier glass, the mirrors are available, and which can magnify your face, and you can able to see yourself, and you can do the shaving, like, or makeup, respective of the male or female. So it depends upon what exactly where you want to groom it and how you can potentially use it out, whether it's a blind patient or the low vision patient. You can manage your medication as well. And different kind of a labeling consideration I have put it here. uh, it can be paper clips, it can be colored advisory labels, there are markers, there are felt tip pens and laundry markers and polymark fabric. So different kind of a labeling and marking you can do it when you want to do laundry or when you want to put it up in your wardrobe. So for the blind people, there are safety pins, rubber bands, there are Velcro, self-stick magnetic tape, there are iron-on patches, weller pads, or furniture protectors. There are furniture protectors. I have put it up in some of the places, and the form alphabet letters and polymark fabric. So spatial labeling products are different, whether it is a braille clothing or bump dots. So if you have a bump dots, which can be black and orange and clear red plastic dots are there to mark appliances, computer or keyboards. So they can identify themselves. They don't need to seek any advices from somebody. And for the clothing identification, it can be have a different white plastic tags are available with a braille and corresponding with a black and white. So that enhance your contrast sensitivity. This kind of a different color tags are available, the mates which are in different shapes and which can put it up in a different wardrobe items, which particular pair of clothes you want to. So many colors are available, as approximately 100. And these are the different kind of a tactile pens are there, a three-dimensional one, plastic liquid which raise the line dots, and if you know the braille you can able to identify that. And So it very easy for the blind person to identify from the button, from the color, from the raised one, and from the different kind of shapes. So there are problems, but there are solutions. That's what I believe it. And the braille and tactile adhesive labels to for the medication, for the food, it can help you out to label contains a raised letter or number with a corresponding braille item. So this is a way you can label it out, what is there, and according to that you can read it, and then you can use for your whole household items. And these are the laundry and laundromats. So different detergents, ironing tips and self-consideration. There are organizing, how you can organize your home with a different structure and the infrastructure, furniture and all. And different kind of bulbs are available for that. Money management also, like you have currency identification or the notex, which you can identify from the different currency notes available in each country. So money identification also, you have banking and credit cards. You can keep your financial record also. You can pay your bills by yourself, and you can record your financial information with a computer if you know the Excel, Word and Excel, Excel sheet and all. So you can maintain that commercial ledger, and you can design yourself, and organizing mails, bills, document paying bills, everything is possible. Even you can see in the lower bottom, the person is writing with a pen with a using a check guide. So in definitely I do have a check guide, and in India we do prescribe check guide also. There are certain recreation and leisure. Of course, we do enjoy ourselves and we have some leisure activity. So does the all the visually impaired people also. These are the accessibility, and telecommunication act was there in United States. So the telephone company must make a phone including the cell phone accessible to people with a disability, including blindness and vision loss. And that is the reason most of the visually impaired can have the self reliant people, you know. So right to access the public transport as per the American with a Disability Act, that give the people disability many important rights in area of transportation, the public buses, those in a wheelchairs, and the driver need to announce their stop out loud. So it can benefit to visually impaired person to ride the bus as well. And the telephones and drinking fountains and the restroom inside the terminal should also be accessible to them. So they take care of many of the things like a local citizen over there. So vision loss does not have the prevent a low vision or blind person from living any active, healthy or fulfilling life. Nothing can be impossible for them. Also, they can enjoy as what we are doing it. So there are many tips and techniques can be learned by visually impaired, retain their independence. In addition, visual rehabilitation services instruction can provide with a technique which can help visually impaired to accomplish many daily living skills, which is it can be done with a safety and independently. The goal of rehabilitation, mind you, it is only to make any person independent. So what is next? You want to continue the same thing what you were doing before, or would you like to change your mindset after looking and after hearing this presentation? I'm sure something I must have educate all of you, and I think so you must start practicing, you must start having lots of questions. Okay, how do you start about it? So she's the one who said, I'm an angel in her life. And she said, I'm not lucky, but I'm very blessed to meet at the right person. And I have guided her and she could able to save her life. And now she's earning and she's able to, feed her family. So there are certain patients to make a difference in somebody's life. You don't need to be a very brilliant, rich, or beautiful. But I think so. What need is a care and understanding. If you care, if you understand, and if you execute the right time the services, I think so you can make a difference to millions of people. He's earning his own livelihood by selling those products. He's a self-reliant guy, uh, making his own daily living. These are some of the vocational training which I'm showing you from the center where I was the head of the department, the tailoring sections. This is the weaving section. Uh, these are the different kind of printed weavings are there. There are different chair canning. Most of the government and non-government, probably old NGOs, they still they are using the chair canning. Uh, We all have our hangers in our wardrobes, and these are the hangers, they make it up. Different candles, they make it up. And when the festival comes, most of the NGO and the different organization comes and gives them an order, and it's a very beautiful to see these candles when they make it up. They make different kind of phenyls and liquids to clean, sanitize, different kind of weaving section here also. She's the one who is operating the computer. He's the telephone operator in NAB India. He's the one who used to do the community-based rehabilitation when I was talking on that slide, where he used to travel. He's a blind since birth, but he has pursued his bachelor and master's in social work. And he's been going to different interior part of Maharashtra state and different rural area, where most of the village where you find out of 50 houses, 10 house may be having visual impairment, or 20 houses. He goes there, he takes the family into the trust and consideration. He talks, he shares what are the options available for the education, for the employment, for the orientation and mobility. And he settles with a different company like a Tata, and they come forward, they extend the small short business program, job employment, and then they start a business in that rural area. So I was amazed to see this, because he himself is a total blind, going to the villages, traveling alone, setting up the business for another blind person, coming back to the main head office. And that's the reason he is amazing today. Right now he is working at one of the best bank in India, in Mumbai, I could say, and a very heading the very high post. So I just have a one tagline for that: okay, nothing is impossible in this world. If you want to do it, you can do it anyhow. These are the light engineering sections. These are the woodwork and the brush section. They made it with a different wood device, instruments. Uh, you can see this, very eco-friendly. Different file and the board sections are there. This all comes into the vocational training, and the particular department has a training for 1 year, 2 years, or 4 years. So once they enroll, we evaluate each blind person, and I will tell them that he is visually impaired in a way, whether what is the best eyesight, what low vision devices can make him a best to utilize the vocational training. And according to that, the organization had higher authority will decide to put it up, and what kind of a vocational training this person require, maybe 1 year or 3 years or the 4 years. So optometry plays very important role in this. Assembly sections, and you are learning the stenography and typewriting. There is the acupressure and massage section. We have the special courses for acupressure, like from 6 months to 1 year. And after that, they can go to home or particular center, they can join, and they can give the acupressure and massage to the patient who requires. Of course, they believe in fitness, and we have a fitness program also. And of late, our government is also promoting fitness, the Fit India. So there are different cultural activities, music class, sports, and cultural activity as well. These are the some of my, I have learned special training for the home management and these braille and the orientation mobility from NAB India. Of course, until unless if I don't know, I can, how do I refer to patient and how do I tell them? So for that matter, especially I had to learn all those things, and it was amazing experience to interact with these females, who are my inspiring people. Lunchtime, and they are doing yoga, they are practicing the Maharashtrian style or cultural dance program, and the different kind of a yoga section is going on. This is about the home management, how to clean the house, you should clean, you should cook, and how to start a gas or stove, your mixer operating, iron, clothing the iron, everything, like, so there are teachers, special educators, who can teach you, who can make you learn and make you independent, whether you be there with your parents or whether you are there with your spouse. even to take a measurement in the water or for the some of the spices in the cooking. You can play the indoor games, whether it is the chess or the playing cards. You can see on the playing cards on the right hand side of the card of the upper bottom, there is a braille dots are there. From the dots, raised dots, you can make out that this number is what, whether it's a 710 ABC, like, you know. So you can play the housey also. There are balls for the outdoor activities, and you can play housey also. So there are different gadgets for the visually impaired. And this is one of the experience which I would like to share. When I went to Andaman Nicobar, these are the Anganwadis workers. We have trained them, and we have given some training and information and educate them for the rehabilitation services over there. It was a wonderful experience to teach them, because Andaman Nicobar Island is very far from the if you say geographically from the India location, and it's very difficult to have basic optometric service also. So low vision service and rehabilitation service was it's a dream come true for them. So of course it made a lot of difference to the local people, and Anganwadi workers were also very happy to learn something about the spatial disability and spatial children's and visual impairment. And we have done a lot of awareness with the district officer and health ministry over there, and radio awareness and paper and print media also. So after that, of course, you get a smiling face on that. This is one of the indoor and outdoor activity for the every day, every year sports day when we organize in NAB India. There are visually impaired who participate from different states. These are the Black Consent group are there who have launched their video album, and they plan more show around the world to spread the messages. So they are the total visually impaired people, and they have the concert and they played wonderful music. These are the one of the low vision rehabilitation. We have sponsored low vision optical and non-optical devices through different NGO, as I said earlier in my presentation, like a Rotary Club or Giants International. They come forward and they finance this devices to them. And we celebrate Worldwide Ken Day on 15th of October. So generally we do participate in awareness to the citizen, how to help them out, and what are the ways and technique to seek, the guidance from. If you know it about how to help the visually impaired, then only you can probably, it's not, you don't want to show it to sympathy to them. And basically when you see the patient or any blind person, you can't assume that they must be needing our help. So there are certain protocols and instruction which you need to follow. Of course, these are the blind females. And I have done some awareness on radio FM about the visual impairment and World Sight Day. I've been rehabilitating a blind organization at Maldives, Indonesia, and Vietnam also, and the Cambodia also. So it really makes wonder, and to see something you are contributing to the different Asian countries. Yes, I feel everybody should be independent like me, and money cannot buy their happiness. I'm sure everybody agree with it. So even if you can make a smile to this wonderful, young, beautiful, visually impaired girls, I think so they make my day. And I have been rehabilitating this to business person. One is a lawyer and one is the uh, entrepreneur. Of course, the life is hard, but it's not impossible. So these are the different family-based rehabilitation we have done. I feel, of course, I have given you some message. So if I ask you any take-home message, yes, success in life depends upon two important things: the vision of seeing the invisible thing and mission of doing the impossible thing. And that's the reason I feel I'm happy to be part of being an optometrist or being into low vision, and I can make a difference to so many visually impaired people. I'm sorry for that background music, but yes, right to sight, incredible India. If any questions? Yes, I have a question. So if a single teacher cannot teach us the all subjects, then how could you expect a single student to learn all the subjects? So happy learning and happy practicing. Yesterday we celebrated a World Eye Donation Day. So I would request each one of you to place to donate your eyes. It's the most beautiful gift you can give it. When I see visually impaired through my eyes, I think we are different. But when I see through them my heart, I know we are the same. I'm proud to be Indian, I'm proud to be woman, and proud to be optometrist. I would like to acknowledge Mero Eyes from Nepal, the Rajgandhi Eye Care Institute, the organizing committee of this webinar, I Talk. Thank you so much, Mr. Kapil, also, who invited me and given me this wonderful opportunity to present here. National Association for the Blind, uh, MNB Industrial Home for the Blind, where I was the head of the department. And this all patients' photos have been taken the permission to put it up in this presentation. The visually impaired participants, my parents, family, the Indian farmers, police and Indian Army. I think so Indian Army is doing wonderful job, and because of that we all are safe here sitting. So thanks to my parents, uh, police and army, definitely. You can get connected to me by email, website, Instagram, Twitter, and the cell phone. And never stop learning because life never stops teaching you. So good evening once again, everybody. I don't know whether I did good job or not, but yes, this monkey says, yes, I have done the good job. So stay safe, stay healthy, stay informed, stay connected, and stay blessed always. Thank you so much. Thank you for listening. Thank you for having me this opportunity. Thank you.
Thank you so much, Yogita ma'am, for such a wonderful session. And moreover, we really appreciate the works that you have done for the visually impaired community globally to create a positive impact in their lives. It's a great honor to have you this evening. Thank you so much, ma'am.
Thank you.
So, well, now we are to the discussion session. So, we'll be taking out the few questions. So, shall we begin? So, we have our first question displayed on our screen. Shall I read it for you, ma'am?
Yeah, yeah. If the patient has a visual acuity, I cannot read here. One sec. 20 by 600. Okay. No further improvement with the pinhole. What further low vision assessment can be done to make a daily life easier? Okay, so visual acuity doesn't improve with the 20 by 600 with the pinhole also. I think so. The first option which you should see, okay, what is the disease because of what the patient has lost the visual acuity. So disorders is very important, diagnosis, and after that, what is the stage of that particular disease? And if the visual acuity do not improve with the pinhole, that means you are not able to do with the normal spectacles or general glasses or medication or surgery probably. If that is the case, then I think so low vision optical device will definitely help. In that case, you have the TV glasses are available now, which works at the 10 feet or 3 meters. And you have the telescope, which can be handheld, depends upon the age of the patient and the dominant eye and the requirement of the task, what exactly he would like to have it in a daily life, whether he would like to walk, whether he would like to see, travel a lot, whether he wants to see the bus number or train or indicator or the shop name, what exactly he would. So according to that, you need to advise the patient whether spectacle mounted or handheld telescope is better or not. And then I think so in the home you can have the TV glasses. So that probably will take care of distance glasses. But for the near vision, there are many options are available. Like you can have the hand magnifiers, 10 magnifiers, you have the reading glasses, and so many other CCTVs are there. So that can also play a very important role, and it can definitely improve the vision. I hope I have answered. If I have any further question, do let me know, please. Okay, does the low vision patient of 60 years old literate man need low vision aids? What are the low vision managements? If he's an educated person, he's a 60 years old, so definitely he may not have the uh, I guess so. I'm not very sure about, as you said, because this doesn't clarify whether he's still working or not working, or whether he is into an entrepreneurship or not. If he's running the business, definitely he would like to have the different kind of a low vision devices. Now, whether the patient is able to move independently, so first you need to have the orientation and mobility devices. Then you need to have the digital devices like a mobile or any other gadgets. CCTV can help him out for the identification of the low vision, reading material, banking, currency identification, and check signing. So those will take care of the different reading glasses and near vision tasks. For the distance, as I said, you need to have the spatial glasses or high magnifying glasses. Depends upon the task of the patient, and whether he wants to read every day like 2 to 3 hours, then definitely spectacle magnifier will be better, because the hands will be free and he can read for a longer time, like half an hour to 40 minutes at a time, having the right lamp behind, in comparison with a stand magnifier, a hand magnifier. Because in the hand magnifier, the patient get tired after 10 to 50 minutes, they cannot hold it, because you can see the age of 60, their immunity also goes down. So physical strength is also less. In that case, the spectacle magnifier for near vision works better. And for CCTV, reading lamp, signature guide, check guide to maintain orientation, mobility, this all comes into the low vision management. And of course, you need to see the patient has lived the life for 60 years. If he lost the vision at the age of 60 years, then it is a very traumatic. And in that case, you need to do the counseling of the patient, because the acceptance level of the patient is not very good. It's below 10%, because he has lived his life for almost 60 years, total independent. And suddenly he has to I'm sorry, suddenly he has to depend on something which he doesn't want to, and which is not the conventional way of treatment or conventional way of acceptance. So it makes a lot of difference for 60 years old patient being educated to accept certain devices. So I think so in that case, the counseling plays very important. You need to reduce the psychosocial factors, and then you can do the evaluation for low vision devices. Then you come to visual rehabilitation and other rehabilitation service as per the patient retired life. Thank you. Can you please name software used for the low vision? There are JAWS software and Magic software. This generally Magic used for the different magnification, but it's not a speech software, where JAWS will access in the speech also and magnification also. So there are two other, where a very familiar one. And besides that, the original one, which comes in a very costly affair. But still, if you would like to have it, you can email to me. I will send you the list of the software which are available. The JAWS and Magic are the common ones. How can we motivate total blind patient? Yeah, as I said, first of all, you need to be motivated. If you think, yes, this person can do it well, I can have many options. If you do not have much knowledge about certain thing, but you can get connected to the local government or district level or the National Association for the Blind, irrespective if you are staying in Nepal or any other country where you have a National Association for the Blind or your country blindness higher authority, you can connect over there, you can talk, you can see what best you can do it for the total blind patient. First of all, the blind patient is child or is a young adult, or the adult, or the after age of 60, where the patient is coming, what age year they are coming to you. So that makes a one difference. Second, the age of the patient, the gender of the patient, whether what patient would like to have the life, whether homemakers or the patient wants to do something and be a self-employed. So according to that, you can train. If the child or the patient is educated, you can train them, or you can give them a career counseling. But if the child or the patient has not been motivated for education, and if they have stopped their or terminated their education at the very young age, then probably you can ask them to join for vocational training, and different kind of vocational trainings are available. After that, there are different NGOs and different bigger companies who can sponsor you, and they can give you some amount of money initially to start those business, what you have learned in the vocational training, and then that person can start doing the small business, and that's the way he can learn the be independent. And of course he need to have the orientation mobility to move independently. So it's like a currency identification, going to the bank, orientation, and managing the self grooming, self care, everything has to be taken care. So there is a particular program with a blind association in Mumbai, in Delhi, or in Tamil Nadu, where you can able to train, and you can take the training for 1 month to 6 months, and then you can ask them to go to the vocational training as per the desire of the patient. As I said, every patient will be different, even the disease is similar. So we cannot generalize anything. There is no thumb rule for one patient you need to have so and so guidelines. So this question is in a very it's not very specific about it, but that's, yes, you can motivate them. You need to have the counseling session, and you can give them a hopes, but there cannot be a false hopes also. If there are options, you can give them options, but you cannot give the false hope to them. Okay, everything will be fine, you will be okay, don't worry. No, if you know, okay, you can do it, then only you can tell them. So that is what I suggest in this case. Thank you.
All right. So thank you so much, ma'am. It's indeed that every patient have the same disease, but every patient is different. I like this quotation. So still, I can see the few questions on the YouTube. So I'm going to read for you.
Yeah.
If a patient is illiterate and has been diagnosed as a Stargardt disease and is the albinism too, so can we please suggest some add to him
Okay, so the patient is a Stargardt disease, that is
and albinism?
and albinism. Okay, so for the albinism, we need to definitely see what kind of albinism, whether it is ocular cutaneous, or complete only ocular albinism. According to that, what is the vision affected, and definitely you will see the you have to advise them about the sun allergy screen lotions whenever he travels in sunlight. When he goes out, he need to have the polaroid or filter lenses to protect from the sunlight, ultraviolet A and B radiations. And besides that, for reading and reading and for the distance tasks, optical devices definitely help them out. Even for the near activity also, there will be optical devices or electronic magnification can help him out. He need to consult the dermatologist for, depends upon the severity of the albinism. So that is the one thing about the Stargardt disease. Yes, you need to have the I think so. You need to have the diet part where it is very important role. You need to tell them about the vitamin A, C and E, and there are certain other nutritions which you need to advise them about the Stargardt. Again, you need to have the optical complete evaluation in optometric workup and the low vision workup. After that, you need to see which eyes are dominant and non-dominant. Only the better eye has to be given the optical devices for the distance and the near task. And the child will be definitely required education, rehabilitation in consultation with the parents, counselor, psychologist, and the special educator, whether the what kind of education system will be better for the child in terms of vision loss. So whether it is a special education will be better, like he's studying only with a blind person, whether it is a inclusive criteria, or whether it is a integrated, whether the child can go to the normal school and study with all normal childrens. So what kind of education system will be better? Along with the 4 team members, you need to decide about it. Okay, what is the best interest of the child and the family also. So I think so in that case, optical, non-optical, counseling, special educator, orientation and mobility, diet control, I think so that all plays very important role for Stargardt disease patient as well.
All right, thank you so much, ma'am, for the insight. So I have another question on my personal takes. He is asking for, ma'am, I want to establish low vision clinic, and what would you suggest for fresher optometrist?
Can I know that person speaking from India or any other country?
It is from Nepal, ma'am. It's a
Nepal.
Satyam Paudel, yes.
Okay, thank you so much. I am very happy to read this question because somewhere I think so I made some difference to one person. Okay, he could generate this interest to start a low vision clinic. Thank you so much. I think so, and I'm happy to welcome you in low vision practice. And of course, on the lighter notes, if you want to start a low vision clinic, you need to invite me a Nepal to your beautiful country. That is a one thing. Besides that, yes, low vision practice, if you have your own practice of low vision, sorry, optometry, then you can, along with that, you can do it. There is no particular specific one infrastructure may require. So of course, low vision setup, you required one kit for that, where you have all the trial sets and optical and non-optical devices. And basically first you need to get the train for it, how to do the evaluation and the visual rehabilitation, the case performer, all the instrument about contrast sensitivity, vision charts, logmark charts. So all those things you may require for to start. It's a very minimum, it's not very expensive affair to start your low vision setup. And besides that, yes, once you are through with it, low vision training and the workshop, educating yourself more, and then you start doing the referral services. You can contact with the different NGO and the ophthalmologist nearby with the retina and cornea specialist. Once they start referring, you see the patient, you see the low vision workup done, prescribe the glasses, do the visual rehabilitation. And after that, you connect with the government sector because you need a blindness certificate as well, as per the Nepal government definition. And then once you have, for without blindness certificate, you cannot do any kind of a rehabilitation services. Even to admit in the school, you require blindness certificate. For vocational training, you require blindness certificate. To travel in the public transport, you required a blindness certificate. To get all those concessions, subsidies, to start a business, you required a blindness. So I think so the government and district hospital plays very important role. And according to that, you can connect with a different NGO if you have a financial constraint as well. And then you can see to patients, and I think so you can connect with a different team of people. I don't think so there should be difficult. Yes, there are challenges, as I said in my presentation, but it will work out after a few months down the line. But
All right.
you should keep motivating yourself, and I'm sure you will come out of it.
Yes, ma'am. So thank you so much, ma'am. So, ma'am, I'm also looking for some suggestion in the policy level. If optometrists have to stand for those blind people, what are the basic criteria that should optometry work on the policy level?
Can you repeat your question again? In a policy level, you mean to say the optometrist has to design the policy for the low vision practice, or?
No, ma'am. Actually, the most of the first doctors, any blind people is connected with is optometrist, right? So, what would you recommend? We are practicing the low vision, but if we have to change in the policy level, just you said like we have to recommend for the low vision certificates. That's how they can go to the different system and they can apply for it, rather than the other things that we have to work, if in your personal experience.
Yeah, basically, if I tell you at the government level, as of now, there are no low vision centers. There is no awareness about low vision because most of the government or the medical professional thinks only conventional treatment is the option for them. But life is there, or the vision is there beyond that also. And the role of optometrist in specific in low vision management start when everybody says nothing can be done. And that is the right time to pick up your patient from there. So my journey start from there when everybody says we cannot do anything. And I can be getting so many patients telling me that we have visited 10, 20, 30, 40 or 45 centers and everybody said nothing can be done. How can you tell me I can do something for you? So basically it is the lack of awareness amongst the patient, among the family community or the medical professional as well. And even though sometimes they know about it, as I said in my slide, health ego is there. So they don't refer the patient to the low vision specialist. And that is why this patient is moving around and they are not able to get the right treatment. So when I say about it, I think so you need to make an awareness. You can make a brochure or some kind of awareness material, educating materials about low vision, distribute amongst your community or locality city or state where you're leaving it, connect to the NGO, connect to the district hospital, tell them about, okay, this is what we are doing it, and show them a data like, okay, these are the patient who got benefited and certain kind of a disease can benefit. So you need to narrate it about cataract or Stargardt disease, AMD, diabetic retinopathy, cataract, which are the major cause of visual impairment in the world. And those patients can be get benefit. And then you can do some screening program. And once you do screening, you can make them aware that certain devices are available. Life doesn't stop here. There are so many options are there. You can live your independent life. I think so.
All
That's
right,
a
so
way.
this is very inspirational words, ma'am. Thank you so much for being kind to those people. And in between, I have a small announcement. We have a next session at June 16 on the best practice standard in optometry by Ms. Paul Mukherjee. So we hope we can meet on the Wednesday at 5:15 p.m. in Nepali time and 5 p.m. IST in Indian time. So before ending the today's session, I'd like to request you, ma'am, give us short notes all.
I'm not able to hear anything. Your voice is cracking. Hello.
If you have any good notes, Yogita ma'am, before ending the today's session, hear you well. Maybe I guess you have a problem with your internet.
Yeah.
Can you hear me now?
Yeah, I can hear you now. Sorry.
All right, ma'am. So
Yeah.
before ending the today's session, do you have any good notes?
Keep motivating yourself and stay informed and connected, and do justice to the many patient who comes to you for low vision. And if you make them happy, make them smile and make them independent, I think so we are doing justice to our profession, because nothing is superior than our profession. We have to do something different to our profession, and that's the reason we are selected for this profession as an optometrist. So I think so I'm proud to be an optometrist and making a difference to many people. So same thing, I think so all the participants, all the listeners can do the same thing in their life as well. So wish you all the best, take care, and anybody can get connect if they have any kind of a question in the future with me. I'm happy to be proud of this session, and thank you so much for inviting once again. And I apologize for keep waiting for you for nearly few minutes before the presentation.
No problem, ma'am. It's always pleasure to hear from you, and we can wait a few more days as well. No problem.
Okay.
All right. So this is
Thank
all
you.
about the today. I hope you will stay safe, stay connected. Thank you so much.
Thank you. Thank you.
Thank you so much, ma'am.
Thank you.